Om Amriteshwari Namaha. Good evening, everyone, and we welcome one and all to the C20 Working Group on Integrated Holistic Health, Mind, Body, and Environment. Thank you all for joining us this evening. Let us start this introductory webinar with a prayer to invoke the blessings of the Almighty. ध्यायामसु विभात भानुवदनां सान्द्रावबोधात्मिकां तत्त्वज्ञानविभूषितामभयदां तच्छब्दविद्योतिकाम् मन्दस्मेरसुभाषितेर्नतिकृतां सर्वार्तिविध्वंसिकां ब्रह्मानन्दपरायणम् अतुलिताम् अम्बामृताख्यां पराम्. Om Namah Shivaya. I'm Dr. Priya Nair, an Associate Professor of Gastroenterology at Amrita Hospitals, Kochi. And I'm one of the coordinators for this working group, along with Professor Jaydeep Menon, an interventional cardiologist and public health specialist at Amrita Hospital. As most of you would already know, C20 or Civil 20 is one of the engagement groups that forms a part of the G20 platform. Integrated Holistic Health is one of the 14 working groups of C20 this year, and the intention of this webinar is to introduce this ever important working group to all of you. We are so incredibly honored to have many distinguished members, national and international, with us here tonight. First, I would humbly request our distinguished C20 Sherpa, Shri Vijay Nambiarji, to give the welcome address. Shri Vijay Nambiarji was the former Special Advisor to the United Nations Secretary General, Shri Ban Ki-moon. Nambiarji previously served as the Deputy National Security Advisor to the Government of India and head of the National Security Council Secretariat. Besides being India's ambassador to Pakistan, China, Malaysia, Afghanistan, Algeria, and the United States, Shri Nambiarji also served as India's permanent representative to the United Nations in New York. Sir, over to you.
Thank you. Just a small correction. I wasn't in the United States. Thank you. I was at the UN. Thank you. Let me, first of all, express my great sense of privilege to participate at this inaugural session of the Working Group on Integrated Holistic Health. The C20 Engagement Group is chaired this year by Her Holiness Mata Amritananda Mahima Devi, or Amma, who embodies the principle of Vasudhaiva Kutumbakam, which is the motto of India's chairmanship of the G20, having literally embraced the entire humanity as her family. She has spent her entire life in mankind's spiritual upliftment and in humanitarian activities, supporting the poor and vulnerable with basic needs of food, water, shelter, healthcare, education, and livelihoods. Over the years, she has also addressed issues such as the protection of the environment, the inculcation of universal values of compassion, inclusiveness, and harmony, and championed them at international forums, including at the United Nations. In pursuing an active agenda during this year, the C20 under India's chair has scrupulously followed the so-called Osaka principles and ensured continuity with the previous presidencies while reflecting India's own distinctive ideas and priorities. This year, under India's aegis, it will come, it will come up not only with a set of policy recommendations to be shared with other nations, but also provide what we have called udaharans, or exemplary success stories or best practices for replication across the world. Now, I'm not a domain expert like most of you on public health or holistic health, so I can only speak in general terms. Health has been a continuous priority over the last 5 C20 summits, and indeed remains so today. While the ravages of the pandemic have largely receded, the world has had to come together to clear the debris and the detritus of the pandemic and to deal with its aftermath. Not only has the disruption of health services in so many countries affected the pace and progress of public health coverage, but negative impacts of the pandemic has led to a steep rise in preventive deaths of several other diseases. While the COVID exacerbated existing vulnerabilities, new ones have uncovered. Alongside the targets of SG3, therefore, the working group now feels it necessary to address new issues or other issues like mental health, nutrition, women and child health and well-being, elderly care, etc., and including other things like One Health and non-communicable diseases. The increased incidence and manifestation of mental diseases has been most alarming among youth. This is mainly due to a significant increase in substance abuse. Now, in general, mental health aspects have suffered neglect in lower income countries due to a multitude of reasons. Now, among the cohorts of our population that have been particularly vulnerable to the impacts of COVID have been the elderly and the children. Almost 45% of the deaths in children under 5 appear to have been caused by undernutrition. Similarly, undernutrition is evident in poorer sections of society, was manifests maximally among pregnant members with far-reaching transgenerational consequences. Major problems of inadequate access to palliative care and pain have also not been addressed, particularly in the elderly. It is critical to address these problems afresh and consider ways to increase awareness and capacity at the household level on the issue of nutrition and healthcare. Now, moving away from silos, we need a health model that is proactive in monitoring, managing, and maintaining the healthy status of the community. And this requires a broader concept of health. It is paradoxical that many medical discoveries of the 20th century have only confirmed many of our traditional natural medicine and One Health theories. So an integrative approach which takes into account areas like Ayurveda, yoga, meditation, actually would obviously contribute considerably to what we call holistic health, considering the whole person, body, mind, and health. Improved efficiency in health delivery, extending healthcare to rural areas up to the last mile, and provision of good quality healthcare at low cost, as well as adoption of e-health initiatives using ICT, are measures that have been undertaken by the government across the country and need to become models for emulation across all developing countries too. We need to examine how we can identify udaharans or exemplary practices from across G20 countries to benefit all countries. As you build on your mission and work in tandem with civil society organizations around the world, I'm happy to see that you have already identified areas where they can participate in network in order to effect change through side events, policy dialogues, exemplary case studies, and lobbying with governments. While welcoming all of you, I am confident that your working group will be able to identify high impact and actionable policy proposals for consideration of the C20 summit in July this year. And then these, I expect and hope, will be taken forward for the G20 leaders to reflect on during their own summit in September this year. Thank you.
Thank you, sir, for your words. We are grateful that you were able to join us tonight. We are incredibly fortunate to have Vaidya Rajesh Kotecha, Secretary, Minister of Ayush, Government of India, here with us today, as well as Pujya Swami Amrita Swarupanandapuri, Vice Chairman of the Mata Amritanandamayi Mutt and Troika member C20 India. Vaidya Rajesh ji has taken time away from his busy schedule to be here with us for a short while. I request you, sir, to deliver the inaugural address.
Thank you, Dr. Priya. Respected Swamiji and Sri Vijay Nambiarji, all other galaxy of participants, my pranams to all of you and my pranams in the holy feet of Reverend respected Ammaji. This is for me. This is an opportunity to participate in this working group, C20 working group for integrated health, holistic health, and I'm sure that, as mentioned by Sri Vijay Nambiarji, this working group will be able to recommend specific recommendations for C20 main summit to be held in July. The focus of last C20 presidency of Indonesia was meant for mitigation of the suffering caused due to the COVID-19 pandemic by listening to the world to recover together and recover stronger. As an extension of the recovery process, the current presidency is focusing on developing solutions for the mitigation of hunger, conflict, extinction of species, and environmental destruction by protecting the environment, promoting social and economic development, and human rights. This echoes the core concept of India's G20 presidency, Vasudhaiva Kutumbakam. Two themes of the current C20 presidency, that is integrated holistic health, mind, body, and environment, and lifestyle for environment, life, directly pertain to the domain of my work as Secretary of the Government at Ministry of Ayush, Government of India. Ministry of Ayush is an independent ministry of Government of India to regulate and promote the growth and development of traditional healthcare systems in India. Together it is known as Ayush, that includes Ayurveda, Yoga, Unani, Naturopathy, Siddha, Homeopathy, and Sovarikpa. During the pandemic, we have worked hard in hand with biomedical health systems and ensured that people got pragmatic health advisory of self-care by using simple yet very effective, scientifically validated household remedies such as Ayush Squad for prevention of infection, recovery from the infection, and reduce hospital stay, and performing yoga, meditation in quarantine for self-preservation and maintaining mental well-being. During this process, many civil service organizations have participated with great synergy, and one of the teleconsultation helplines for Ayush advisory were provided free of cost by a CSO. In this context, I would like to recall celebration of International Day of Yoga 2022. It was celebrated at 75 iconic locations in India with theme Yoga for Humanity, and with wherein innumerable number of CSOs, other non-government organizations actively participated at various fronts. 79 countries were present in a unique program of Guardian Ring, which was a collaborative exercise between 79 countries, the non-government organizations, civil service organizations of those countries, and government of those countries, Indian missions, UN organizers, etc. And that is a very, very great showcase to illustrate yoga's unifying power that surpasses national boundaries. I would like to dwell a bit up on the themes of the today's IHH, that is integrated holistic health, in the context of the traditional medicine in India, mental health, holistic health, one health, nutrition, women and child health, elderly and palliative care, and non-communicable diseases. We all know that all these areas, when we talk about the health, there are so many contributions possible from traditional medicines of India and all the traditional medicines of the rest of the world. And then that should be used, because we are talking about the health and not just disease management. For example, in mental health and holistic health, Ayush system focus on creating and preserving the human body's perfect metabolic balance and maintaining optimum health in a natural way. In the light of recent COVID-19 pandemic, Ayush is witnessing strong traction across the world. Ayurveda's successes in managing lifestyle diseases, chronic illnesses at physical and mental plane present a highly receptive environment. Ayush Health and Wellness Centers are a good example. We are establishing 12,500 Ayush Health and Wellness Centers at primary care level across the country of India, out of which 9,000 plus centers are already operational. And this is a model of holistic wellness to reduce the disease burden, out-of-pocket expenditure, and to provide informed choice to the needy public. The functional integration with existing establishment for providing comprehensive care by using standard protocols, upgradation of infrastructure, community mobilization for self-care, sensitization and capacity building of healthcare providers, linkages with higher level facilities, Ayush educational institutions, reputed NGOs and trusts, and documentation with the help of IT platform are the highlights of the activity. So I have just put this example. There are so many such examples. And in One Health also, antimicrobial resistance also, there are so many evidences and publications that we can look at for this IHH model of healthcare. Similarly, in nutrition, women and children health, we have partnered with the Women and Child Development Ministry of Government of India, and we are working together for holistic nutritional care for women and children and integration of Ayush into Poshan Abhiyan and control of malnutrition through the principles and practices of Ayurveda, Yoga and other Ayush systems. And eventually our goal is to achieve Suposhit Bharat, and we have this vehicle as a Poshan Panchayat across the country. Participating panchayats and village level bodies is a very good model to look at this wonderful dissemination of holistic healthcare model of integrative health. Similarly, in elderly health and end of life care, there are evidences available. There is a report I want to mention about this NSO's Elderly in India 2021 report, where they have mentioned a specific importance of Ayush. Similarly, in the areas of non-communicable diseases, there are so many possibilities to work together and to create a model. To conclude, I should mention just a couple of lines that Ayush medical system in India and traditional medical system from different parts of the world are here to put in all the efforts to integrative holistic health through evidence-based and ensure that we all together achieve one world, one health. That is the goal. The new paradigm of healthcare is moving from illness to wellness, from treatment to prevention and early diagnosis, and from generalized approach to personalized medicine. The one world, one health approach through better communication and coordination between various stakeholders, collaborative efforts will help to address societal challenges presently faced in the global healthcare sector. I wish the team, experts and participants of C20 working group for integrated holistic health a great time during deliberations and concrete roadmap to achieve one world, one health as part of G20 presidency led by India. Thank you. Pranams.
Thank you so much, sir, for your inspiring words. We request you, sir, to release our inaugural video outlining the major focus areas of the Integrated Holistic Health Working Group.
This year, the C20 Integrated Holistic Health Working Group will comprise 7 subgroups with areas of focus that include mental health, nutrition, women's and children's health, elderly care, holistic health including traditional medicine like Ayurveda, as well as yoga and meditation, the reduction of non-communicable diseases, and One Health, a concept that highlights the interdependence of human, animal, and environmental health as one species, one world. Delving into these themes, we aim to widen the discussions on different facets of Sustainable Development Goal 3, good health and well-being, with policy building meetings and series of public webinars and awareness campaigns that will take place throughout 2023. These discussions will bring together health professionals, educators, and leaders from across the public health landscape to formulate policies that support global health and well-being. Inspired by the humanitarian activities of Amma, Shri Mata Amritanandamayi Devi, the present chair of C20, we hope that this upcoming series of events will raise the general awareness in society and spark interest in people to contribute to the conversation surrounding global health. As we embark on this journey to understand the health of the world around us, C20 will offer all members of civil society an opportunity to recognize how our individual experiences and efforts can lead to policy change. Let's work together to create a healthier, more equitable world. Good health is a fundamental human right, and it's up to all of us to make it a reality for everyone.
Thank you again, sir.
Thank you.
On behalf of C20 and Mata Amritanandamayi Mutt, we express our sincere gratitude to you for all your support, and we pray that we will be able to work with you even beyond C20 to promote holistic health. Thank you. We are honored to have Sampuja Swamiji with us as both the Troika member and as a representative of the chair of C20, Paramapuja Sri Mata Amritanandamayi Devi. Swamiji, we invite you to enlighten us with your thoughts and directions for this working group.
Om Amradeshwariyai Namaha. I humbly bow down at Amma's sacred lotus feet. My namaskarams and loving greetings to all the experts, dignitaries, and professionals gathered online. The English language evolved in the early 1300s. The English word health derives from the word hal, which was used at the time. The single word hal was initially used to convey three meanings: healthy, whole, and holy, which later came to be three separate words. So when we talk about health, it is supposed to be the integrated well-being of a person, which eventually creates healthy individuals, healthy societies, and a healthy world, healthy in word and deed. Of course, modern medicine has introduced revolutionary changes in the treatment of diseases. And the present day humanity cannot exist without such state-of-the-art treatment methods. However, even today, when science and technology are taking big leaps, one crucial factor is ignored again and again, which is our food habits, the right intake of food, and secondly, the right exercise. We fill our system with all sorts of unhealthy food. It invariably affects our body, mind, emotions, and intellect in a negative manner. Unfortunately, our thinking about health is only limited to the body. We are only concerned about physical well-being. The body is only one part of human existence. There are other innumerable subtle aspects that sustain our physical existence. We have to accept the fact that modern medicine also has its limitations. While it has made remarkable changes in transforming the area of health, it's not infallible. What modern medicine cannot accomplish, traditional treatments can, and vice versa. Hence, a balance needs to be created. That's why the revival of traditional medicine such as Ayurveda is important. Normally, allopathic and traditional medicine doctors do not accept each other. They scoff at each other. It's high time that they change their attitudes and learn to understand the significance of both systems especially with the fatal threats that our planet is facing. There was a time when a huge section of society disregarded climate change. They thought it was a myth. But now, when the truth is staring at humanity, they cannot but accept the fact. How did climate change happen? It was coming closer and closer, mainly due to humanity's corrupt and uncompassionate ways of treating nature. And where and what is the source of this greed, which led to overexploitation and unethical invasion of nature and its bounty? The human mind, right? And what is mind? It is constituted of unsystematic and unbroken thoughts. And what the thoughts are made of? The thoughts are made of food. Not only the food we eat to appease our hunger, but food also refers to the intake of the information we gather through the eyes and ears as well. This is the age of internet. We know how people become addicted to electronic gadgets and how it affects their emotional and mental health. This is not different from any physical disease, perhaps more subtle, hence more painful. In short, it is most important to create a balance between modern medical treatment and the ancient methods formulated by the great sages. Why am I saying this? The second chapter in the 12th canto of the Srimad Bhagavatam, which was written over 5,000 years ago, there is a description of Kali Yuga, the modern day world. In there, you will find some astounding predictions about what is happening in today's world. Owing to time constraints, I will share the translation of some of the verses. I quote, "In Kali Yuga, wealth alone will be considered the sign of a man's good birth, proper behavior, and fine qualities. And law and justice will be applied only based on one's power. 2, men and women will live together merely because of superficial attraction, and success in business will depend on deceit. Womanliness and manliness will be judged according to one's expertise in sex, and a man will be known as a Brahmana just by his wearing a thread. 3. As the earth thus becomes crowded with a corrupt population, whoever among any of the social classes shows himself to be the strongest will gain political power. 5. Harassed by famine and excessive taxes, people will resort to eating leaves, roots, flesh, wild honey, fruits, flowers, and seeds. Stuck by drought, they will become completely ruined. 6. The citizens will suffer greatly from cold, wind, heat, rain, and snow. They will be further tormented by quarrels, hunger, thirst, disease, and severe anxiety. The last one, losing their wives and properties to such avaricious and merciless rulers who will behave no better than ordinary thieves. The citizens will flee to the mountains and forests. Accurate, right? So my point is, please don't discard the views of the ancient sages like trash. Don't consider them primitive and senseless. As Alma puts it, what they said thousands of years ago are coming true in today's world. So humanity has no other way but to follow dharma, a dharmic way of living. There is a scriptural dictum, Sarvam Parabasham Dukham, Sarvam Atmavasham Sukham, Edad Vidyat Samasena Lakshanam Sukhadukhayo. Meaning, everything that is in others' control is painful. All that is in self-control is happiness. And this is the definition of happiness and pain in short, and that indeed should be the definition of health. The definition of health as in Ayurveda is Charaga Samhita, Sarva Sharirendriya Swatma Samyogo, the union of Sharira, body, Indriya, sense organs, mind, and soul. And Veda means knowledge. Hence, Ayurveda means the knowledge of the union of the body, sense organs, mind, and soul. So when people bless saying Dirghayushi Bhava, in India, when you touch the feet of the elders, they will bless you saying Dirghayushi Bhava. It means let you be in union with all the above factors for a long time. During Navaratri, we worship Durga on the first 3 days, Lakshmi on the next 3 days, and Saraswati on the last 3 days. This culminates into the final day, the victory, Vijaya Dashami. In order to live a happy life, it is important to remember and invoke the grace of all three powers, Lakshmi, wealth, Durga, health, and Saraswati, knowledge. Amma says, but we should pray for 2 types of boons from each of these goddesses, 2 types of health, physical and mental from Durga, 2 types of wealth, external and internal from Lakshmi, and 2 types of knowledge, outer and inner from Saraswati. When these 3 Shaktis, health, wealth, and knowledge are balanced, happiness simply happens. When we are sick, we think that health is most important. In poverty, we feel that wealth is most important. In every action we undertake, understanding and knowledge is most important. So speaking in percentages, each one of these powers scores 33.33%. Health, wealth, and knowledge are necessary for survival, happiness, and success in our ventures and for life itself. So remember these 3 powers every day and train us to balance them so that not only individuals, but society as a whole is benefited. There is a Japanese proverb. If one can do, you can do. If no one can do, you must do. In today's world scenario, this proverb can be rewritten as, if one can do, let him do. If no one can do, what can I do? There is yet another attitude. If one can do, don't let him or her do it. May each one of us develop the selflessness, willingness, and right attitude to offer whatever we can do toward the well-being of the entire world. May this confluence of health professionals have the openness to view and accept health as a whole, not in parts, and may each one of you be able to contribute to transforming our planet into a better place for humans, nature, and other living beings to coexist in peace and harmony. Thank you so much. Om Amradeshwariyai Namaha.
Our pranams to you, Swamiji, for taking the time to join us for this inauguration. Your tireless guidance will ensure that we are able to make a big global impact in the field of public health. The chair of C20, Srimata Amritandamayi Devi, inaugurated the C20 engagement group on the 16th of January. We would now like to share a short video of the health-related excerpts from this speech. We are sure that these words will guide us through this journey of engagement and innovation.
മനുഷ്യ ശരീരവും ഈ പ്രപഞ്ചത്തിലെ മറ്റ് ചരാചരങ്ങളും പഞ്ചഭൂതങ്ങളായ ഭൂമി, ജലം, അഗ്നി, വായു, ആകാശം എന്നിവയിൽ നിന്നും ഉടലെടുത്തതാണ്. പഞ്ചഭൂതങ്ങളുടെ ഉറവിടം പ്രകൃതിയാണ്. അതുകൊണ്ട് പ്രകൃതിയും മനുഷ്യനും ഒന്നാണ്. ഈ സത്യം അനുഭവതലത്തിൽ അറിഞ്ഞതുകൊണ്ടാണ് ഋഷികൾ വസുദൈവ കുടുംബമെന്ന് ഉദ്ഘോഷിച്ചത്. ഈ ഉപനിഷത്ത് വാക്യം G20യുടെ ആദർശവാക്യമായി തിരഞ്ഞെടുത്ത് എല്ലാം കൊണ്ടും ഉചിതമായി. പ്രകൃതി മനുഷ്യൻ്റെ അജ്ഞാനവർത്തിയാണ്, അത് നിർജ്ജീവമാണ്, അതുകൊണ്ട് എന്ത് വേണമെങ്കിലും ആകാം എന്നൊക്കെയുള്ള മിഥ്യാധാരണ മനുഷ്യർക്കുണ്ട്. പ്രകൃതി ഒരു ശരീരമാണ്, അത് ഏകമാണ്. ഒരു ശരീരത്തിലെ അവയവങ്ങളെല്ലാം അഭേദ്യമായിരിക്കുന്നത് പോലെ പ്രകൃതിയിലെ ജീവനുള്ളതും ഇല്ലാത്തതുമായ സകലതും അന്യോന്യം ബന്ധപ്പെട്ടിരിക്കുന്നു. അവയെല്ലാം പ്രകൃതിയുടെ അവയവങ്ങളാണ്. ഭൂമിയും ജലവും അഗ്നിയും വായുവും ആകാശമില്ലാതെ മനുഷ്യൻ എങ്ങനെ ജീവിക്കും? ഈ 5 ഘടകങ്ങളാണ് മനുഷ്യ ശരീരത്തിന് അടിത്തറ. അവ പ്രകൃതി നമ്മുടെ അകത്തും പുറത്തുമുണ്ട്. നമ്മളെല്ലാം ഭൂമിയിൽ ജീവിക്കുമ്പോൾ സഹജീവികളെയും പ്രകൃതിയെയും അവഗണിക്കുന്നു. സ്വന്തം സ്വാർത്ഥ താല്പര്യങ്ങളും അത്യാഗ്രഹങ്ങളും സബലീകരിക്കാൻ വേണ്ടി മാത്രം പ്രയത്നിക്കുന്നു. അതേസമയം സ്വർഗം തരണേ എന്ന് ഈശ്വരോട് പ്രാർത്ഥിക്കുകയും ചെയ്യും. ഇതെന്തൊരു വിരോധാഭാസമാണ്. 21-ാം നൂറ്റാണ്ടിൻ്റെ ഏതാണ്ട് കാൽഭാഗം പിന്നിടുന്ന ഈ സന്ദർഭത്തിൽ എന്താണ് നമ്മുടെ ലോകത്തിൻ്റെ അവസ്ഥ? കണ്ണുകളടച്ച് ലോകത്തിൻ്റെ ഭൂപടം എവിടെയെങ്കിലും തൊടുക. കണ്ണു തുറന്ന് അത് ഭൂമിയുടെ ഏത് പ്രദേശമാണ്, ഇത് രാജ്യമാണെന്ന് നോക്കുക. അതെവിടെയാണെങ്കിലും അവിടെ ശാന്തമാണോ, സംഘർഷരഹിതമാണോ? അവിടെ മനുഷ്യന് വിശപ്പും ദാഹവും അടക്കാനുള്ള ശുദ്ധജലവും ഭക്ഷണവും കിട്ടുന്നുണ്ടോ? അവന് കിടക്കാൻ തലയ്ക്ക് മുകളിൽ ഒരു മേൽക്കൂരയുണ്ടോ? ധരിക്കാൻ വസ്ത്രമുണ്ടോ? വൈദ്യ ചികിത്സ സമയത്തിന് കിട്ടുന്നുണ്ടോ? സ്ത്രീകളും കുട്ടികളും സുരക്ഷിതരാണോ? ഈ ചോദ്യങ്ങളുടെ ഉത്തരം അമ്മ പറയാതെ തന്നെ എല്ലാവർക്കും അറിയുന്നതാണ്. പണക്കാർ സ്വന്തം ബംഗ്ലാവിൽ ആഡംബരങ്ങളുടെ നടുവിൽ നിന്ന് കരയുമ്പോൾ പാവപ്പെട്ടവൻ ചോരുന്ന ഒടിഞ്ഞ കസേരയിൽ നിന്ന് കരയും എന്ന വ്യത്യാസമേ ഉള്ളൂ. നിരവധി സംഘടനകളും വ്യക്തികളും പരിഹാരങ്ങൾ കാണാൻ ശ്രമിക്കുകയും ജീവകാരുണ്യ പ്രവർത്തനങ്ങൾ നടത്തുകയും ചെയ്യുന്നുണ്ട്. പക്ഷെ അവയെല്ലാം കടലിൽ വീഴുന്ന തുള്ളികൾ പോലെ മാത്രമേ ആകുന്നുള്ളൂ. ഈ വെള്ളത്തുള്ളികൾ മരുഭൂമി വീണാൽ അതുകൊണ്ട് ഉപകാരമുണ്ട്. എന്നുവെച്ചാൽ തലം മനസ്സിലാക്കി നമ്മൾ പ്രയോഗിക്കുകയാണെങ്കിൽ അത് തീർച്ചയായിട്ടും അവരിൽ ഉണർവും സന്തോഷവും സമാധാനവും ആരോഗ്യവും എല്ലാം കൊണ്ടുവരാൻ സാധിക്കും. യുദ്ധ സാമഗ്രികൾ സംഭരിക്കുന്നതിനേക്കാളും ശ്രദ്ധ അതാത് രാജ്യങ്ങളുടെ കുഞ്ഞുങ്ങളെ ശക്തിയാർജിക്കാൻ നമ്മൾ കൊടുത്തിരിക്കണം. മനസ്സിനെ എങ്ങനെ മാനേജ് ചെയ്യണം, അങ്ങനെ ആകുമ്പോൾ എല്ലാത്തിനെയും മാനേജ് ചെയ്യാൻ പറ്റും. നമ്മൾ അഗ്രികൾച്ചർ പഠിച്ചിട്ടാണല്ലോ കൃഷി ചെയ്യുന്നത്. അതുകൊണ്ട് അവിടെ വരുന്ന എന്തെങ്കിലും രോഗം വന്നാൽ മരുന്നടിച്ചു കൊടുക്കാനൊക്കെ സാധിക്കും. അതുപോലെ നമ്മുടെ ജീവിതത്തിൽ ഇങ്ങനെ ആയിരിക്കണം. ലോകം ഒരു പുഷ്പം പോലാണ്. ഒരു ഇതിലും ഒഴിവെടുത്താൽ അത് മറ്റുള്ളതിലെല്ലാത്തിലും ബാധിക്കും, പുഷ്പത്തിൽ മൊത്തം ബാധിക്കും. അപ്പോൾ രാജ്യത്തിൽ വന്നത് ഇപ്പോൾ മറ്റുള്ള എല്ലാ രാജ്യത്തിലും ബാധിക്കും. അവർ വ്യക്തിക്ക് വരുമ്പോൾ കുടുംബത്തിന് വരുന്ന സമൂഹത്തിലേക്ക് പോകുന്നു. അങ്ങനെ സമൂഹം രാഷ്ട്രം ലോകത്തിലേക്ക് പോവുകയാണ്. ഇത് പൊതുവെ മനുഷ്യൻ്റെ ആരോഗ്യത്തെക്കുറിച്ചുള്ള പലരുടെയും സങ്കല്പം ശരീരത്തിൻ്റെ തലത്തിൽ മാത്രം ഒതുങ്ങുന്നു. മനുഷ്യൻ്റെ നിലനിൽപ്പ് ശരീരത്തിൽ മാത്രം ഒതുങ്ങുന്നില്ല. മനസ്സിൻ്റെയും ബുദ്ധിയുടെയും വികാരങ്ങളുടെയും ആരോഗ്യവും പരമപ്രധാനമാണ്. അതിലുപരി സകലരും ചൈതന്യം പകരുന്ന ഏകമായ ആത്മശക്തിയെ അംഗീകരിക്കുകയും വേണം. ഇവയെല്ലാം തുല്യമായി പരിഗണിച്ച് പരിപാലിക്കുമ്പോഴാണ് ആരോഗ്യ സംരക്ഷണത്തിൻ്റെ അർത്ഥം പൂർണ്ണമാകുന്നത്. ആധുനിക വൈദ്യശാസ്ത്രത്തിനും ചികിത്സാ സമ്പ്രദായങ്ങൾക്കും തീർച്ചയായും അതിൻ്റെതായ സ്ഥാനവും പ്രാധാന്യമുണ്ട്. പക്ഷെ രോഗം വരുമ്പോൾ മാത്രം ചികിത്സ തേടുന്നതിലല്ല ശരിയായ ആരോഗ്യ സംരക്ഷണം. യഥാർത്ഥത്തിൽ പ്രകൃതിയാണ് നമ്മുടെ ഉറ്റ മിത്രം. കാരണം നമ്മൾ പ്രകൃതി തന്നെയാണ്. അതുകൊണ്ട് ആരോഗ്യ സംരക്ഷണം പൂർണ്ണമാകുവാൻ പ്രകൃതിയുമായി സുരചേർന്ന് നീങ്ങേണ്ടത് ഏറ്റവും പ്രധാനമാണ്. ഇപ്പോൾ നമ്മൾ തന്നെ ആളുകൾ വേസ്റ്റ് ഇടുന്നിടത്ത് മണ്ണെടുത്ത് നോക്കി മൊത്തം പോയിസണായിരുന്നു. അവിടെ വൃക്ഷം നട്ട് വളർത്തി. അതൊരു 3 വർഷം കഴിഞ്ഞപ്പോൾ ആ മണ്ണെടുത്ത് റിസർച്ച് ചെയ്തപ്പോൾ വിഷമേ ഇല്ല. ആ വേരെത്ര വിഷം പിടിച്ചെടുത്തു. ഇലകൾ നമ്മൾ കാർബൺ എത്ര എടുത്ത് നമുക്ക് നല്ല ശുദ്ധവായു തരുന്നു. വൃക്ഷത്തെ ഈശ്വരനെപ്പോലെ ആരാധിച്ചിരുന്ന പഴയ ആൾക്കാർ. നമ്മളൊക്കെ ഒരു വൃക്ഷം വെട്ടുമ്പം പൂജിച്ച് മാപ്പി വെച്ചിട്ട് വെട്ടിയിട്ടുള്ളത്. അങ്ങനെ ഓരോ ജീവജാലങ്ങളെയും അന്ന് നമ്മൾ ആരാധിച്ചത് തന്നതിനുള്ള നന്ദി കാണിച്ചതാണ്. അപ്പം നമ്മളതൊരു പ്രാകൃതമല്ലാത്ത പ്രായോഗികമായിരുന്നു. അവിടത്തേക്ക് നമ്മൾ തിരിച്ച് കുറച്ചെങ്കിലും പോയേ പറ്റുള്ളൂ. ആവശ്യങ്ങളുടെ പുറകെ പോയാൽ നമുക്ക് എല്ലാവർക്കും ഭൂമിയെ തന്നെ സ്വർഗമാക്കാം. ഒരു പൂത്തലിൽ നിൽക്കുന്ന ഒരു പൂന്തോട്ടം ഓർക്കുക. അതിൽ കുറേ കുട്ടികൾ ഓടിച്ചാടി കളിക്കുന്നു. അതിൽ പൂമ്പാറ്റകൾ എങ്ങനെ തേൻ കുടിച്ചും അത് മറന്ന് കളിക്കും. ഇങ്ങനെയൊരു ലോകം ഉണ്ടായിരുന്നെങ്കിൽ ഞാൻ ആഗ്രഹിച്ചു പോവാണ്. പൂമ്പാറ്റകളെന്ന് വെച്ചാൽ എല്ലാ ജനങ്ങളും ആഹ്ലാദിച്ചു. അപ്പോൾ എല്ലാവർക്കും അവർക്ക് അവകാശപ്പെട്ടേ കിട്ടും. ഇവരുണ്ടാക്കുന്നെല്ലാം കൊടുക്കണമെന്ന്, എന്തെങ്കിലും കുറച്ചെങ്കിലും അങ്ങോട്ട് ചെന്നാൽ ഒരു ദീപായി നമ്മൾ മാറില്ല. ഇപ്പോൾ ദീപായി കൊണ്ടുപോവാണ്. ഒരു സിംഗിളുടെ കണ്ണി ആയിത്തീരും.
I am sure that these words will not only be a source of inspiration, but will also help all of us awaken that light within us. I would now like to request Dr. Jaydeep to introduce the Chopal portal for inauguration.
Thank you, Dr. Priya. As a part of our outreach to civil society, we've created a portal called the Integrated Holistic Health Chopal portal, where any member representative of any community, organization, or group could voice his or her views and concerns and even suggest steps to mitigate the same. Registrants are also given an option to upload a document or even an image. And this would ensure for inclusiveness of even marginalized and indigenous communities and ensure civil participation to the fullest on a global basis. For this, may I request Sampujya Swamiji to please inaugurate the portal for us. Thank you, Swamiji. We are so grateful to you, Swamiji, for joining us tonight. We invite everyone to spread the word to all your family and friends through social media and other mechanisms. We invite everyone to share their ideas and thoughts with us because no suggestion we think is insignificant. Your every thought and intention counts.
I would now like to introduce everyone to our International Advisory Committee. We have with us Dr. Andy Cohen, Director, Clinton Health Access Initiative and Indigenous Health Solutions, Dr. Krish Ramachandran, Associate Professor Anesthesia, Harvard Medical School, and Dr. Sarthak Das, CEO, Asia Pacific Leaders Malaria Alliance. This group of people have been a guiding light for this working group. I would like to open up the dais. Does anyone have any thoughts they would like to share? Yes, Andy?
Thank you, Dr. Priya. I would just like to say that the work that the Integrated Holistic Health Working Group is embarking on is of crucial importance at this time in history. The holistic perspective in particular will help us identify the best ways to understand and address the impact of things like climate change and environmental degradation on human health. I'm also really inspired by the consideration that the health subgroups, the vertical groups, are giving to the integration of gender equality and other complex equity issues. Thank you so much for the honor of serving on the International Advisory Committee, and I really look forward to the recommendations that we gather and put forward together.
Hello, everyone, and my pranams to all of the great dignitaries on stage, and also the amount of positive energy that is being brought together by this group under the able leadership of Dr. Priya and Dr. Jaydeep. From our side, it's really, I fall back to, knowing is not enough. One must do, and this is so important in today's world. Everyone knows everyone is an expert today. You don't need these three experts. Everyone is an expert, but knowing is not enough, and we need to learn how to work together and do, and this is going to be a big part of the success of this group. I feel the first steps are amazing. We've got a lot of inputs from people. We have to be empathetic. We have to listen not just to the powerful voices here, but listen to everyone and figure out a way in which that input makes its way in a meaningful manner into our actions.
Thank you all so much for the honor of being part of this group. And I am deeply, deeply humbled to be in the company of this particular gathering. And the only thing I would add here is to say that what my colleagues in this group and the verticals have been truly open to and working on is really making this about taking a real attempt at building solutions and what one could call a science of delivery, but making that science be something that truly comes from the roots of where the work actually happens. So we really, really hope that groups around the world, especially those who are where, as many of us call, where the pavement ends, will be the ones who use this opportunity far and wide to help us understand what actually works, and so that we can then synthesize that together to present something meaningful in July and in September at the G20. Thank you.
Thank you, Dr. Andy, Dr. Krish, and Dr. Sarthak. Under your able leadership, I am sure that our final set of policy recommendations will be powerful, globally relevant, and practical. I would like to take a moment to explain the key focus areas of our working group on integrated holistic health. We have 670 registered NGOs so far in the area of public health, representing over 70 countries worldwide. Based on the profile of registered NGOs, 7 key focus groups have been created to discuss and brainstorm solutions, which will ultimately form part of the C20 policy pack submitted at the G20 summit later this year. I'd like to take a moment to introduce the key focus groups and the domain experts that will be coordinating those particular areas. First, we have our honorary advisor, Dr. Prem Nair, Group Medical Director, Amrita Hospitals. Amongst many accolades, he has been a strong advocate for public health programs driven by non-governmental organizations and was instrumental in setting up the Amrita School of Public Health. He also spearheaded the Amrita Telemedicine program and is the Vice President of the Telemedicine Society of India. We request you to share a few words.
Om Amriteshwari Namaha. My humble comes to our most beloved Amma, Sampamaji, distinguished delegates from around the world. On behalf of Amrita Hospitals and the Amrita University campus, we are delighted to have this opportunity to facilitate the C20 process for integrated holistic health. Non-governmental organizations or civil society organizations play a very critical role in public health delivery by filling gaps in services, resources that are provided by governments and other institutions. NGOs are often able to respond very efficiently and very quickly, and are often reach the more marginalized and underserved populations that might be overlooked by traditional healthcare providers. NGOs also often have more community-oriented approach, which allows them to better understand the needs and customs and tailor their interventions accordingly. Additionally, NGOs can go as advocates for public health issues, raising awareness and mobilizing support for important health initiatives. Their flexibility and innovation makes NGOs essential partners in the health of communities around the globe. India is a unique country wherein there are highly affluent parts of society, yet at the same time, there are many areas that suffer dire poverty. This gives India the ability to potentially understand healthcare delivery and its complexity at multiple levels. I'm sure that with the incredible ingredients that so many registered NGOs bring to the table, the discussions and deliberations will be exciting and enlightening. We will do our very best that we come up with a comprehensive and practical set of policy suggestions based on everybody's input. Thank you all for joining us this evening. Om Amriteshwari Namaha.
Thank you, Dr. Prem, for spending this time with us and guiding us as we go through this process. I'd now like to introduce the rest of the team. For overall coordination, we're fortunate to have with us Dr. K.R. Tangappan, who's one of the foremost public health experts in the state and country. He's the former director of the Achyuta Menon Center for Public Health, nested in the Sri Chitra Tirunal Institute of Medical Sciences. Leading us in mental health, we have Dr. L.M. Frey, clinical psychologist and a professor at Amrita Vishwavidyapeetham. Guiding us through nutrition and health, we have Brahmacharni Nivedita Pavitran, head of the Department of Clinical Nutrition at Amrita Hospitals, Kochi. For women and child health and wellness, we have Dr. Sarita Shekhar, associate professor of cardiology, and we have Dr. Vinita Prasad, professor of pediatrics. Under the banner of holistic health, Dr. Ram Manohar P., who is the eminent Ayurveda physician. He is the director of the Amrita Center for Advanced Research in Ayurveda. Dr. Manasi Menon, a doctor at the Ayurveda Hospital and Ayurveda University in Kollam. Narinder Ji, who is leading the way with meditation, and Brahmacharini Shobha, who will be coordinating for the yoga discussions. Under the vertical of elderly care, end-of-life care, and palliative care, we're fortunate to have Dr. Shobha Nair, Head of Department of Palliative Medicine, and Dr. Priya Vijay Kumar, Professor of Geriatrics. To help coordinate One Health, we have Dr. Deepu and Dr. Merlin Moni. And last but not least, under the banner of non-communicable diseases, we have Dr. Chandrasekhar and Dr. Ashwati. All registered NGOs will be working closely with these coordinators over the next 6 months, along with working closely with many other eminent and dedicated CSOs in the field of public health, including the AIDS Healthcare Foundation, Stop TB Partnership, Inclan Trust International, Sangat, HelpAge India, Vadwani Foundation, and so many more. Initially, we will have a series of online engagements to identify key problem areas. Once this list has been created, we will have a hybrid event in Faridabad, Haryana, near Delhi. There we will work on practical and implementable solutions. We will also showcase udaharans or examples of best practices, which will then be forwarded to G20 nations. We will have one more such event in May on the 6th and the 7th in Kochi, Kerala, which will focus exclusively on Ayush streams of medicine as well as mental health. We encourage all registered NGOs and CSOs as well as domain experts to participate in person if possible, because the events will be vital to the creation of our policy write-up. Now coming to another exciting part of this webinar, I feel privileged to call upon Lady Rosalind to deliver her address. Lady Murata is a vice chair of the Global Fund to Fight AIDS, Tuberculosis, and Malaria. She has 4 decades of experience in Papua New Guinea's public and private sectors. She worked in the National Planning Office as an advisor to its Department of Finance before launching a career in community work as Papua New Guinea's First Lady in 1999. And this has given her a deep knowledge of global development and health policies, as well as Papua New Guinea's economy, environment, and health systems. We know it is very late at night for you, and you've taken the time to be here in person. So we thank you again, and over to you.
Thank you very much, Dr. Priya. Distinguished representatives from India, the G20 and C20 host for 2023, ladies and gentlemen, it's a privilege and pleasure to join you today. Thank you for your support in the fight against pandemics, including the fight against HIV, tuberculosis, and malaria. As the only multilateral organization specifically created to combat pandemics, the Global Fund is uniquely positioned to work with partners to support countries in preventing, preparing for, and responding to pandemics. The Global Fund partnership uniquely brings together donor governments, implementer governments, the private sector, technical partners such as the World Bank and WHO, and most importantly, civil society and communities. Over the last 20 years, working together, we have saved 50 million lives. Long-term investments to strengthen health systems are fundamental for the fight against the 3 diseases and for equitable universal health coverage. They are also essential for pandemic preparedness and response. Over the 2021-23 implementation period, the Global Fund would invest around $5 billion in formal and community health systems. Investments to strengthen the key building blocks for fighting current and future pandemics, such as routine surveillance, laboratory systems, data systems, procurement and supply chains, qualified healthcare workers, and community systems. The Global Fund is calling on the G20 to reaffirm its strong commitment and support for existing health organizations. Efforts to enhance pandemic preparedness and response must include the fight against existing infectious diseases, building upon existing health and community systems and infrastructure, and ensuring equitable access. The fight against antimicrobial resistance is a critical challenge that we must address more vigorously. Drug-resistant TB poses a huge risk to global health security. The Global Fund welcomes India's focus on AMR and is calling on the G20 to include effective measures to keep existing diseases like TB, HIV, and malaria treatable as a key part of the AMR agenda. All members of the C20 have a unique opportunity to make a difference by raising awareness, advocating for increased resources, and promoting efficient and effective programs. The Global Fund is deeply committed to and practices meaningful civil society engagement and leadership. In continuation with past C20 processes, we look forward to working with the C20 to ensure transparent and inclusive civil society and communities' participation in the overall G20 process at both the national and international levels, thereby enabling meaningful engagement in various G20 working groups, Sherpa, and finance track meetings. Thank you for your solidarity, support, and advocacy. Together, we can make a difference. Let us work together to build a better, safer future for all. Thank you.
Thank you, Lady Rosalind, for your inspiring words. And I'm quite sure what you touched on would be further discussed during the course of our discussions and may form a template as well, especially in the areas of tuberculosis, malaria, and probably AIDS as well. Thanks so much for sparing your time for us. As the next speaker, we have Padma Shri Dr. K. Vijayaraghavan, an emeritus professor and former director of the National Center for Biological Sciences in the Indian Institute of Sciences. His areas of specialization are developmental biology, genetics, and neurogenetics. He was also the former secretary of the Department of Biotechnology in India and also the principal scientific advisor to the Prime Minister of India. Over to you, sir.
Thank you very much, Dr. Jaideep Menon. Distinguished colleagues, it's a great pleasure and honor to be here at this session on holistic health. I will be very brief, and because much of what I wanted to say has been said by the previous speakers really well. Let me just start by saying and pointing out the interconnectedness of all life on this planet. And the reason for that is we know that evolution has a common origin, and all life has therefore a shared chemistry. And that shared chemistry is connected by the thread of DNA. And therefore, our understanding of any organism helps enormously in the understanding of any other organism. A second important principle in the development of all organisms, plant and animal, but particularly relevant for us today is the development of humans, is that there are a few underlying basic principles in how all animals develop. These principles are shared, interestingly, by all animals, and therefore the toolkit, the regulatory toolkit which makes one animal is actually very similar to the regulatory toolkit which makes another animal. Now, coming to us, different tissues and organs in our body are also made by this toolkit, with the downstream components differing as needed. The result of this, therefore, is an important conclusion. When some part of our body goes wrong and needs to be fixed, we try to do that by interventions with drugs which restore normal function. But restoring normal function requires an intervention in that tissue, but also acts on all other tissues where this toolkit also functions. And therefore, it is very difficult to have a specific effect where needed and not affect other normal parts. So this is one component to keep in mind. And therefore, ways by which we can assess the effectiveness of interventions and manage that in a specific location are very important. Now, there's another problem in that there's significant variation amongst each of us, and therefore, an intervention which affects one person in one way can affect another person in another way. Now, contrast this with other approaches which don't look inside the organism, inside the body, and these are traditional approaches, which look at treatment in a specific context and look at the efficacy of the treatment. Today now, we have a great opportunity, and I'd end by stating this, combining both these approaches of observational studies on impact of interventions and more detailed cellular and molecular studies of how they function, collecting data on large scale from individuals across different societies, different lifestyles, different genetic backgrounds, and in different contexts, and trying to see which are the kinds of interventions which can have the maximum benefit with minimum side effect and minimum other impact. So these kinds of integrated data-driven approaches combined with cell molecular biology and traditional approaches are going to be critically important. And for that, we need to see a collaboration between all of us. Thank you very much.
Thank you so much, sir, for your words and for being here with us tonight. I feel honored to be welcoming Dr. Soumya Swaminathan, former chief scientist of the WHO, a pediatrician by training with exceptional research output, especially in the areas of HIV and tuberculosis. Over to you.
Thank you so much. Thank you very much for inviting me. And I'm sorry that I'm not able to turn my video on at this moment, but I hope you can hear me all right. I would like very much to agree with what the previous speakers have said. And I just want to make a couple of additional points. I think the C20's theme and mandate actually has a lot to contribute to the G20 discussions this year, which of course India is leading. So the 3 points that I'd like to make is first and foremost about equity. And I think what we heard from the Swamiji particularly resonated, because what's happened in the world today is that we've exploited nature a lot, but the people who've lived in harmony with nature and who've contributed the least to climate change are today paying the biggest price of climate change. These are the most vulnerable and marginalized communities who lived in harmony with nature, whether these are coastal fishing communities or whether they are tribal communities who've been forest dwellers. Their traditional livelihoods have been snatched away from them, and they're losing it also because of climate change. So we need to think about, as we protect our biodiversity and natural environment, how can we promote the conservation of species and at the same time sustainable development, which will also improve the livelihoods of these very, very vulnerable communities. So that is my first point, and it's about equity. The second point is also related to that, and that is the burden of non-communicable diseases, which is growing so rapidly in India and many other developing countries. Diabetes, hypertension, cardiovascular disease is a result of systemic changes in our lifestyle, in our food systems and patterns. This has been touched upon by previous speakers. And what we saw during the pandemic was that there was a sort of a confluence of an infectious disease which caused a disproportionate burden in terms of mortality in those with underlying non-communicable diseases. So we have to do everything we can, both in terms of promoting individual behavior change, which has been very nicely articulated by previous speakers, but also at the policy level, we need to make it easier for people to adopt that change. We need to make it easier for people to afford a healthy diet. We need to make it easier for people to access nutritious food. We need to make it easier for people to exercise in their own, environments near their homes. And we have to do everything possible to reduce pollution, air pollution, and water pollution. I just came back from a visit to a tribal area in Odisha, and the major problem the people face there is water. Water for drinking, water for agriculture, water for their other household needs. Without water, without sanitation, we cannot expect to have a healthy and a well-nourished country, or any country for that matter. The third very quick point I want to make is about misinformation and anti-science. I fully agree with what Professor Vijay Raghavan just said about the need for high-quality research, high-quality data. And even as we promote these integrated holistic systems, it will be our responsibility to collect that data and to provide scientific and rational information to the general public so that they're not misled by a few anti-science groups. We see a proliferation of anti-vaccine groups. This is very harmful for society as a whole. We have conquered many infectious diseases because of vaccines, and we can lose those gains that have been made over the last 30 or 40 years. So promoting scientific literacy, promoting health literacy could also be one of the goals of the C20. Thank you very much, Priya. Back to you.
Thank you, Dr. Soumya, for those truly inspiring words. And God bless you. Keep up the wonderful work that you've been doing all these years. Next, I'd like to call upon Dr. Bernadette Ebela Rader. I feel honored to be introducing her. She works at the WHO, leading the work on diseases associated with a human-animal interface at the Department for Control of Neglected Tropical Diseases. Previously, she worked for the WHO Department of Food Safety and Zoonosis, US FDA, on antimicrobial resistance. Over to you, Dr. Bernadette.
Thank you very much. And it's really a great honor to be with you today. Thank you for inviting me at this very distinguished opening. And just to start off with, all the others have already introduced all the concepts that set the stage for this working group, where civil society is so critical, because the world is facing many complex crises as it changes rapidly. People, infective agents, food, commodities are moving in an interconnected world. The global population is growing, with many moving to cities that expand quickly and with very little planning. So there are trade-offs in sustaining the environment, the food supply, and our climate is changing. So we have seen the spread of infectious agents, antimicrobial resistant determinants, vectors, and vector-borne diseases that are rapidly expanding around the world. And to tackle these complexities, we need a One Health approach to connect the dots across the different sectors. And of course, we must not forget the most vulnerable among us in society. And of course, this is very close to my heart. I work on the endemic diseases. It's not only the pandemics that have an impact on the livelihoods and the well-being of society. It's really also those diseases that have an insidious presence in communities. But COVID and other crises have derailed our efforts to deliver on health, on the Sustainable Development Goals. However, it has also shown beyond a doubt the importance of health of people for the health of our nations. The case for the redoubling our efforts is really now very clear. And we need this collective effort that goes beyond the health sector, a whole of government approach and a whole of society approach. And you as a C20 have an important role to bring priority area of holistic health to influence the needed change to improve health and well-being of the nations and safeguarding also our planet for future generations. And I look forward to engaging with you further as we come closer to delivering the outputs of the C20. Thank you very much for having me today.
Thank you, Dr. Bernadette, for sparing your time on a Sunday. And we surely would keep you engaged on the further proceedings, especially in the areas of One Health. And we'll keep you updated as well. Thank you so much.
Thank you.
Next, we have Dr. Poonam Khetrapal Singh, an Indian national who became the first woman to assume the office of WHO Regional Director for the Southeast Asia in 2014. Prior to that, for over 2 decades, she was a civil servant in India as a member of the Indian Administrative Services. Her various roles included that as a Secretary of Health and Family Welfare, Managing Director of Punjab Financial Corporation and Punjab Industrial Development Corporations in the state of Punjab. Over to you, Dr. Poonam.
Honorable Chair, C20, distinguished international and national coordinators, working group members, representatives of civil society and community-based organizations, partners, and friends. It is my privilege to address this inaugural C20 meeting of the Integrated Holistic Health Working Group. My best wishes to representatives of each of the domains. In the shadow of the COVID-19 crisis, your task is more important and urgent than ever. As the COVID-19 pandemic has shown, civil society and community engagement and empowerment for health are critical to building health system resilience and strengthening emergency prevention, preparedness, response, and recovery. The title of the working group, Integrated Holistic Health, Mind, Body, and Environment, resonates with the WHO definition of health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Holistic health typically considers the whole person, body, mind, and spirit. A holistic approach to healing goes beyond just eliminating symptoms, and it underpins attainment of Sustainable Development Goal 3 on health and well-being. The key health system framework for achieving SDG 3 is universal health coverage, and it is not possible to achieve UHC without meaningful engagement and empowerment of communities. I am a firm believer of full participation and engagement of civil society. My best wishes to this working group in developing concrete, evidence-based solutions that give genuine voice to the most vulnerable and marginalized. Leave no one behind is not a mere slogan, but a call to action in achieving the 2030 Sustainable Development Agenda. In each of the domains that this working group will address, civil society and community engagement and empowerment are critically important across all the domains of the health systems, especially in health systems governance, to ensure the voice of the people at the highest level of policy making and implementation. Communities are not mere beneficiaries. They must be equal partners in decision making that impacts their lives and livelihoods. Civil society and community-based organizations have a unique vantage point from which they can assess services, providing valuable insights that bring lived experience to the fore. They can not only identify gaps in service delivery, but also find innovative, people-centered solutions, drawing on first-hand knowledge of what works, what doesn't, and what could really turn the tide. They can provide critical inputs to inform research and development priorities, while at the same time mobilize whole of community awareness and action, catalyzing a cascade of change. Holistic health and medicine is premised on treating the person as a whole, mind, body, and spirit. It takes into account the physical, mental, and psychosocial aspects. This is the essence of people-centered healthcare. Primary healthcare that WHO has been advocating since 1978 and which is a foundation for health for all. Again, communities are at the heart of it. As you can see, we have identified communities as key partners. However, there has been a lag from policy to action. C20 can help turn the wheel in the right direction. Throughout this working group's tenure, I urge you to consider, first, how best health and political leaders can engage with and empower civil society and community groups to address the physical, emotional, environmental, and social components of health, taking a holistic, integrated approach. Second, how can civil society and community groups help overcome the many barriers that prevent access to healthcare and which limit people's ability to lead a healthy lifestyle? Ayurveda and yoga have important lessons there. Stigma and discrimination is still pervasive for many health conditions like mental health, neglected diseases, and even cancer. Civil society has a role here in busting myths and misinformation. And finally, how best civil society and community groups help in ensuring people's voices, lived experiences, needs and expectations which are reflected in policy, program design, and service delivery to help people stay healthy, access timely and affordable quality care when sick. How communities and community-based organizations can help expand service delivery closer to where people live. How people-centered, people-led, integrated, holistic healthcare is not just an aspiration. It can and should happen. I wish you all the very best in your efforts to achieve active and engaged communities for universal health and well-being. Thank you.
We are grateful to Dr. Poonam for sending us this video. Her words were truly inspiring. Next, I'm honored to invite Mr. Gorgi Jallow. He serves as the CEO of Pan Africare at their headquarters based in Dakar. Prior to that, he was the country director for Senegal at Africare. He possesses more than 20 years of experience in design, implementation, monitoring, evaluation, and management of development programs across health, agriculture and food security, micro-enterprise, and microfinance, and good governance as well. We're so honored to have you here with us. Thank you. Over to you.
Thank you very much. Can you hear me?
Yes.
Thank you very much. I'm very sorry I was traveling from the field. Thank you to C20, distinguished members of the group. I'm very honored to be in the group and provide my experience and the experience of our organization. Pan-Africare derived from Africare. Africare was, a US-based organization who worked throughout Africa for almost 15 years to, next to the community to try to work with community, build, sustainable and around health and food security. 3 years ago, the leadership was transferred to Dakar, and I have the honor to be the inaugural, CEO. So I'm very happy to be here, and I'm very happy to bring my contribution. West Africa is facing, Africa in general, and West Africa, where I'm sitting, are facing many, many challenges, especially when we talk about, the communities. Challenges are tied to political instability, insecurity, where we are talking millions of IDPs are facing in a daily basis some basic services that they need to face, including health, food security. And this is why my organization is working next to the community to try to see how we can build up, sustainable solution to give them the chance to live a better life. To do so is very important, and this is one of the key focus of our strategy to raise their voice. Leaders of the world need to empower community thinking and community voice within the strategy and intervention. They figure out, for them. That's why I'm very happy to be present in this group. And we expect that, in the coming month, we're going to bring, our 15 years of experience working on the last mile, knowing exactly the real need, the barrier, that block access to basic health care, that block access to food security. And this is something that we do focusing on the underserved community and groups. You have millions of people who are suffering in a daily basis, living in a ridiculous poverty, in a world, in a more, rich world, in a more intelligent world, and something needs to be done, and it's urgent. That's why, we are very happy to be inside this group, and we hope that, during this next month, we'll be able to provide our experience, and, to reach that goal, that all policy and all intervention figure out and fund it, throughout the world can definitely reach the real need of the community. what they really expect, to have a better life, and also give a better chance and better hope, to their kids, for the future. Thank you very much. And as I said before, I'm very sorry that was very short, and I'm traveling from the fields. I'm sorry if the sound was not very clear. Thank you very much.
Thank you, Mr. Gorgi. What comes from the heart goes straight to the heart. The audio may not have been of the best of quality, but it came out loud and clear. The C20, I may reiterate, is not limited to 20 countries. We hope to reach out to all 205 nations. And one part of the globe that's not been covered as well is Africa. This year, we hope to reach out to as many voices as possible from your continent. Thank you once again, Mr. Gorgi. And next, I'm very happy to be introducing Professor Sachin Chaturvedi, who currently serves as the Director General at the Research and Information System for Developing Countries, which is a neutrally based think tank. He works on issues related to developmental economics involving development finance, sustainable development goals, and South-South cooperation apart from trade, investment, and innovation linkages, with a special focus on world trade. He's also the Vice Chairman of the Atal Bihari Vajpayee Institute for Good Governance and Policy Analysis. Over to you, sir.
Thank you. Thanks a lot, Dr. Jaideep Menon. Thanks, Dr. Priya Nair, for this opportunity and for inviting T20, the Think 20, to the C20 meeting. Let me at the outset congratulate you for thinking of C20 working group on integrated holistic health. And I think this is most appropriate as in the T20, we have something that we call as the task force on life, which is very much about lifestyle for environment. And I'm chairing that task force where we are trying to see how holistic solutions are possible and in what way we bring in ethics and finance together. And as we heard Dr. Vijay Raghavan and Dr. Soumya Swaminathan, I think it is important for us to see how technology, how science and advances in science follow what at RIS we call as AEI, access, equity, and inclusion. And that I think is important for technological advancements. The leadership that Amma has provided with C20 and with Ambassador Vijay Nambiar actually leading it from the front, I think, Dr. Menon, it would be important for us to think how the cross-domain connect of our technological sort of approaches, our approaches with our traditional medicinal practices, our practices which are based on specific Ayurvedic knowledge insights, and our connect with integrated health frameworks. I think the mutual trust, benefit of technological accomplishments, testing, empirical evidence, all are extremely important in terms of how we take these cross-domain connects and cost-effective delivery of health services. We have seen the rise of intellectual property and the power of open sourcing. And this, I think, are extremely important mechanisms which are important for integrated holistic health delivery mechanism. With T20, Think 20, we would be extremely delighted to take the process forward. I'm glad that Dr. Mehra from the Science 20, S20 is also here. I think some of the engagement groups may work together in terms of how we take the idea forward. I think India's G20 presidency is extremely important as we need to emphasize on ethics and value system. I think the science and technology, economic development, which is the primary mandate of G20, somehow we are seeing that material or of initial management by the international financial institutions, donor agencies international organizations, and even UN agencies. It is possible without making any kind of noise on ethics and value system. I think the limits of this knowledge frontier, they have proved out very well. We need to take cognizance. Indian G20 presidency must add this in terms of not only holistic health management, but as I said, in terms of access, equity, and inclusion, we should bring that up. So it's a great pleasure. Thanks, Dr. Jaideep Menon, for giving me this opportunity. As I said, we would be very happy to take our understanding of traditional medicine together. With the Ayush Ministry, we are planning to have a wellness forum, which Indonesia has already provided leadership on. Sometime soon, we would be planning a wellness forum in New Delhi, and we would very much like C20 and your working group to join us. Thank you. Namaskar.
Thank you, sir. Access, equity, and inclusion. We hope that with your guidance, we'll be able to keep this approach as the foundational principle of our further discussions as well. And I'm sure that we will, that C20 will continue to work with T20 for the next few months, and we would be very happy to join you at the Wellness Forum as well. So thank you again, sir, for joining us. I'm honored to introduce Dr. Narendra Mehra. He is an Indian immunologist and former Dean of Research and holds the ICMR Dr. C.G. Pandit National Chair at All India Institute of Medical Sciences, an elected fellow of the International Medical Sciences Academy, the World Academy of Sciences, Indian National Science Academy, and National Academy of Sciences, India. Mehraji is known for his research on histocompatibility and immunogenetics. Over to you, sir.
Thank you very much, Dr. Priya. Thank you for giving me this opportunity to speak to this very august gathering. I represent here the Indian National Science Academy and the S20 engagement group, the Science 20 engagement group, and I bring to you greetings from Dr. Ashutosh Sharma, the head of INSA, and also the co-chair of the S20 engagement group. Science 20 was started in 2017 during the presidency of Germany, and since then 6 annual meetings of Science 20 have already been held on various topics of global interest. Science, of course, is one of the most important channels of knowledge that generates solutions for everyday life, unfolds great mysteries of the universe, and it is important for improving the quality of life. Societal engagement with science and citizen or civil participation is essential to equip them to make informed personal and professional choices. The overarching theme of Science 20 this year is disruptive science for sustainable development. We have 3 sub-themes in that. One is on the clean energy for greener future, other for science for society and culture, and the third one, which is very similar to yours, and that is on the universal holistic health. The emphasis for us is on disruptive innovation aspect of science that identifies the nature and essence of the overarching theme. It is essential for us to develop a comprehensive plan, forging collaborations with other similar groups such as yours and the G20 Working Group on Health. We are happy to note that the main focus of C20 is integrated holistic health involving mind, body, and environment with focus on One Health, women, children, and the elderly. Similarly, under the universal holistic health sub-theme of Science 20, our group is specifically focusing on 3 areas, and these are physical and physiological, social, psychological, and emotional. And third, very important, of course, the indigenous approach to health and well-being. Indeed, there is a visible complementarity, as you can see, on health-related issues between Civil 20 and Science 20. Honorable Spiritual Amma has so very clearly shown us the path that the universal or the integrated healthcare considers emotional and spiritual well-being and all other dimensions of an individual as important aspects of physical health. Holistic or comprehensive health encompasses harmony and balance in all aspects of health, physical, emotional, social, spiritual, and intellectual, all of which need to be effectively addressed. Creating better global health would not only mean creating better medical infrastructure or ease of access in medical care, it will also require sustainable practices which would help enhance cumulative global health standards. Towards the end, let me state that it is desirable to have futuristic and advanced healthcare technologies made available through global sharing of research, thereby creating an ecosystem that connects with international academia and industry. As has already been stated, it is imperative to assess the role of data, artificial intelligence, and machine learning technologies to create a global holistic health ecosystem. We wish the Civil 20 a grand success. I'm sure that the final document by your engagement group would give valuable leads for achieving holistic health. We at Science 20 and you at C20 could work together on this front. Thank you very much and namaskar.
Thank you, Dr. Mehra. Thanks for your inspiring words. And I'm sure that there are a lot of common areas that we could work on and take forward. And we look forward to working with your group alongside Dr. Professor Asutosh Sharma as well. Thank you. Next, I'm actually privileged to be introducing Professor Muhammad Abul Faiz, who retired as the former Director General of Health Services in Bangladesh and has been consultant professor and head of the Department of Medicine and Dean of both Chittagong and Dhaka medical colleges. His areas of special interest include tropical diseases and infectious diseases and toxicology as well. Over to you, Professor Faiz.
Thank you, Dr. Jaideep. I feel very honored to be here in this virtual inauguration of the Civil 20 Working Group. Very distinguished speakers, Honorable Chair, and learned audience. Greetings from Bangladesh. Let me start with the Bangladesh knowledge that we developed in the past few decades. There has been continued progress in the economy and in the basic public health parameters, including increasing vaccination coverage, water, sanitation and hygiene, and control of major infectious diseases such as diarrhea, malaria, TB, all of which resulted in improved maternal childhood mortality. Still, gaps remain. In low-income countries, there still remain important gaps in non-communicable diseases and injury, NCDI poverty, and several neglected tropical diseases such as snake bite, pandemic preparedness, climate-related health conditions, and R&D investment. Social protection of the community to reduce out-of-pocket expenditure and avoid the pernicious poverty trap is an urgent need. For this, we need translational research with rapid and responsive funding from domestic resources supported by G20 and other development partners. Repeatedly, community engagement has been mentioned by our learned speakers. A vibrant civil society participation and advocacy, such as Bangladesh Health Watch, Public Health Expert Forum, etc., is a strength in Bangladesh. Enhancing community engagement through public-private partnership will benefit the health system and the delivery of healthcare. In summary, distinguished speakers, I would like to say that intelligent, appropriate, flexible, and rapidly delivered support is essential for our continued progress in LMIC. With this, I'd like to thank you again for your attention. Thank you. Over.
Thank you, sir. We hope that we will be able to highlight key issues in low-income areas like neglected tropical diseases and non-communicable diseases and come up with practical solutions with the guidance of CSOs through the coming few months. Next, I would like to invite Professor M.K.C. Nair, He is currently the Professor Emeritus in Developmental, Behavioral and Adolescent Pediatrics in the Child Development Center and is the former Vice Chancellor of Kerala University of Health Sciences. His efforts in bringing up the center as an autonomous center of excellence in early child care and education, adolescent care and education, premarital counseling, women's welfare, and associated fields is exemplary. Over to you, sir.
Good evening, everybody. Let me start by giving my respect to Amma, Mother Amrudanandamai, and also Swami Amruta Saruvanji. I must thank Dr. Jaideep Menon and Dr. Priya Nair for pulling me into this group. My respect to all the participants from India and the whole world, all over the world. Now, as I had the good fortune of being a Vice Chancellor of Kerala Medical University or Health Science University, and what fortune I had was, there were 324 institutions, both allopathy or modern medicine, Ayurveda, homeo, nursing, pharmacy, everything. So this 5 years was my learning point, how to understand all systems of medicine, appreciate all systems of medicine, and support to have evidence-based medicine in all systems. I really would like to bring in what Soumya Swaminathan said. Let's not, while going overboard with something, let's not do something which will not scientific. That is something. So evidence-based to begin with, at least initial stages have been done. Now let's look at India as one of the leading, low and middle income country. As a leadership there, we have reduced the maternal and child mortality to a great extent. Very successful story, not fully complete, but very successful. Now, this is a time where we should be thinking about the quality of survival. When I say quality of survival, the whole large group of children with disabilities. And if you look at disability and study the whole thing from any angle, ultimately it will come to low birth weight of the baby. Nearly 25 to 30% low birth weight. The crux is low birth weight. So my first proposal is to look at the nutrition of 6 to 10-year-old pre-pubertal girls, which will ensure good growth spurt, because the height of the mother and anemia together forms 40% of the attributable risk of low birth weight. Excellent studies have been there in Pune. So my first proposal is we should have a program for this. Will apply to all low middle income countries. India has gone beyond that, but still all low middle income countries. The second would be the pre-conceptional health counseling, because most of our problems start with intrauterine growth retardation. And what the pre-conceptional health counseling can do is focus on anemia in pregnancy, nutrition in pregnancy. We can talk about rubella vaccine, which is almost another 2 years, we are going to make it universal, and folic acid supplementation to prevent neural defects in the brain. The third point I would like to emphasize is what UNICEF has been proposing and supporting for a long time, and that is the first importance of the first 1,000 days of life. That means 270 days in pregnancy, 365 plus 365. The first 1,000 days, because all your development happens at that stage. The foundation happen at that stage. So this is really possible with a massive ICDS program in India. Probably ICDS or Integrated Child Development Scheme is the largest child development program anywhere in the world. And another 2 years or 3 years, we are going to have the 50th anniversary. So if we can provide one more Anganwadi worker, then 0 to 3 year age group children can be taken care of. No program in the world has shown that much result in the grassroots level as the ICDS program. Because if you go to an Anganwadi, you see such children with such bright faces who otherwise would have gone into that dull group. That is the most important. Then the next point I like to say is, whenever we suggest all this, why I'm suggesting this is because these are ideas that can be practiced by all systems of medicine. There is no medicine involved in any of this. It is only health care, not medical care. So whether it is Ayurveda, modern medicine, homeopathy, or any system can actually come together on some of these non-controversial issues. Improving the health of the community, there's no controversy at all. Now, the last, of course, is I want to suggest is for the adolescent. The mental health, let us not equate the lowering the mental health issues or high incidence of mental with drug alone. No, that is making it so simple. It is not drug. 42 years of counseling experience has showed me it is not the drug alone. Drug is there for the extreme cases, but the majority of children do not get what we call as home care. The home care which supported not only physical, the emotional health, and much more important, spiritual health. The problem that has come now is that when you say you are a modern person, you deny spirituality. And I think that has to go away. That is exactly what Amma was trying to say. Your growth, physical growth and emotional growth should not be equated with the spiritual growth. It has to go simultaneously. So what I am proposing is a self-counseling program for adolescents. We cannot produce counselors to counsel them. We need to make them have self-counseling. Yoga will be part of it. Spirituality will be part of it, as well as some psychological support will be part of it. These are the programs that I am suggesting. And I believe this will be most useful for low and middle income countries, not necessarily the G20 nations as such, but I'm sure it will help them also. Thank you. Thank you very much for the opportunity.
Thank you, sir. Inspiring as always. Words of wisdom accrued over so many years, and I'm sure all of that has a lot of bearing on the future and needs to be worked on. I'm also equally sure that the Wellness and Child Health Group have taken note of whatever you said, and you would be further engaged in further discussions as well. Thank you, sir. And now let's move on to, and let me welcome Sri Rajiv Vasudevan, the Managing Director and CEO of Ayurveda Hospitals. Rajiv is a founding charter member of the TIE Kerala, member of the first technical committee set up by the Government of India for the formulation of NABH standards for Ayurveda hospitals, and chairman of the first core group on Ayurveda set up at a national level by the Confederation of Industries India, the apex industry body in 2016. He is also a representative of the B20. Over to you, Mr. Rajiv.
Thank you very much, Dr. Jaideep Menon. It's indeed a privilege to be speaking speaking at the culmination of a long galaxy of speakers who preceded me. You know, when we look at the basic construct of C20 and civil society in particular, the indivisibility and the interdependence of various parts of society, government, the markets, and the individual, C20 stands at the confluence of that. And so therefore, we look at life in totality. It is the fabric of life in totality. When we look at I would be speaking in the minutes allotted to me on the role of business in particular and the role of healthcare business in further focus. So when we look at the paradigm that is currently there of biomedicine and biomedicalized approach to health, to move from a paradigm of physical health to psychosocial, cultural, economic, political, and ecological health, not be confined to just the physical health aspect, to look at going from disease to well-being and health, to go from the patient being a passive beneficiary of health provision to being both as a participant and as community as an active participant, to go from drugs, vaccines, and interventions towards curative impact, to go to enablement, empowerment, autonomy, preventive and promotive health. This complete paradigm shift, if it has to happen, we have to go beyond just the tenets of business to look at it from the eyes of C20. The role of business, and when we come to integrated holistic health, to look at it not only from the point of view of individual, but as a healthcare system, how do we provide the cradle to grave or preconception to grave? Dr. M.K.C. Nair very eloquently talked about this challenge. And so when you go from cradle to grave health, you go from rural, peri-urban, urban health, the role of primordial prevention to tertiary prevention. Ayurveda, traditional systems of medicine have played a huge role to play. Dr. M.K.C. Nair talked about nutrition. It's not just the nutrition that we would give, but the ability of the mother, expectant mother, to assimilate, to metabolize that, of the young 0 to 5 child to metabolize that food that is being given. So in totality, there is a different perspective where, which Ayurveda traditional systems would bring in. When you look at role of business, on the other hand, I am reminded of Paul Polman, a former CEO of Unilever, who talked about corporate strategy based on sustainability. And in the process showed a path to corporate business where they could double or triple their profits while being responsible towards society as a whole. So this concept of responsible business, where we move beyond corporate social responsibility and regulatory compliance to looking at how do we keep sustainability, gender equality, human rights, all of that as part of business strategy, is something that I strongly feel has to be one of the core strategies of core engagement points of C20. I want to conclude with 2 quick points. When we look at integrated holistic health, we have to look at the health of employees and families. So business looking at the health of their employees and families, so that not only productivity goes up, but motivation goes up, alignment, fulfillment of the employee base. That's a very direct impact. In addition, the impact of the health of communities and customers. Today, when I sell something, what does it do to my end consumer? So this larger thing of societal impact. I want to complete by telling that the launch of the Chaupal, right, is a fantastic step. Business should engage on that. And through this, to ensure that growth with profits will happen together, right? And somebody did speak about the whole of society approach. Ayurveda will offer a very good healthcare paradigm that unifies the indivisible and empowers the interdependence. We would be very happy from B20 to engage with the Civil 20 group and to take it forward in a much more aligned fashion. Thank you very much.
Thank you, Mr. Rajiv. Real clarity of thought there and so lucidly put. Thanks for your thoughts, and we really look forward to working with your group B20, which I believe that we'll be reaching out to you very soon. Thanks, Mr. Rajiv. And with that, we come to the end of the list of speakers. It's been an absolute, truly big learning experience for all of us. The inputs we've got from every one of the speakers has been absolutely wonderful. And I think it would serve us as a good template and directive for future discussions. Thank you one and all for all your time and support, and hope to keep you all engaged in further discussions. Let me not forget Vijay Nambiarji and Swamiji, who actually laid the ground out for us as non-medical people. Then we went on to touch on the international advisory committees and our core committee members. And then came the array of speakers, all global leaders in their own right. We all that has been spoken today would probably will try our level best to put it into action, and we promise you that. And let me not forget the backroom boys and girls who have actually put this program together. Thank you for the support in getting everything done. I end with that. Over to you, Priya.
Just a reminder to all of those who registered with us, we have a series of webinars every 2 weeks. Aside from this, we will have multiple online events where key problem areas will be identified and best practices discussed. You will all receive invites based on the focus areas you had marked on your registration forms. We invite everyone to participate in person for our main C20 Health Summit on the 8th and 9th of April. But in case you're from out of India and you're not able to make it, we will have a hybrid option kept ready for everyone. There will be many interactive workshops and panels which will help finalize our set of recommendations. As per the wish of our Chancellor, Amma, our hospitals are represented by Sage Sushruta, who is the perfect symbol of integrated health. Known as the father of surgery, he symbolizes the potential of integrative medicine. We lit up our Sushruta statues in both our healthcare campuses tonight with the colors of G20 as a symbol of this kickoff event. We are so incredibly excited to work with all of you. And in Amma's words, I pray that all of us together become the light of the world. Thank you all for joining us. Om Amriteshwari Namaha.